Good afternoon, everyone. Welcome to the Protect Our Care Illinois webinar, Defending the Affordable Care Act and Medicaid. My name is Jessica Terlikowski, and I'm with the AIDS Foundation of Chicago, one of the partners of the Protect Our Care Illinois coalition. We're very excited today to start this conversation that is really going to focus in on the current threat to the Republican plan that was just released, posed to healthcare for millions of Americans, including Illinoisans. We have a really robust agenda today with fantastic speakers who are going to talk about the ways in which some of the highlights of the bill that just dropped, as well as ways in which we as individual advocates and organizations can really engage to fight back and save healthcare for all of us. I wanted to just mention that a little bit about the Protect Our Care Illinois Coalition. We are a statewide coalition of healthcare advocates, providers, consumers, and workers who are really working to prevent repeal of the Affordable Care Act and prevent disastrous changes to Medicaid. And we're working to protect and expand access to quality and affordable health care. We invite all of you to join the Protect Our Care Coalition if you have not already. You can learn more about it, and we'll be talking more about ways to get involved as well as ways to join throughout the course of the webinar. I wanted just to let folks know, as a little couple of housekeeping and logistical pieces, that all attendees are currently in listen-only mode. You will be able to, or actually you can submit questions at any time during the course of the webinar using the chat feature. So we encourage you to do that throughout the course of the webinar. We have time dedicated at the end of our conversation today with presenters, at the end of the presentation, for you all to, for us to engage in a conversation with the presenters. One thing just to note, so because we have so many folks that are in attendance, which is fantastic to see, so many people interested in the topic that we're covering today, that questions are not going to be able to be submitted over the phone, but just to be able to submit through the chat function. And if you are having any problems with the audio or with the webinar, you can go to preventionjustice.org for troubleshooting assistance. So just so you know, here's a picture of the chat box. So you have information about ways in which you can ask questions through the chat box right there, or through the question box rather. And we encourage you to join the conversation through social media. You can do that through Twitter at Protect Illinois Care, and also use the hashtags Protect Our Care, Save ACA, and also hashtag Medicaid Matters. And if you're having any issues with the slides or would like to download the slides, you can, for the webinar, you can do so at Protect Our Care Illinois. So we have a lot on our agenda today. We're going to be talking about, we're going to get started with a bit of a Civics 101. Dan Rabbit from Heartland Alliance is going to start us off with how a bill becomes a law, which will be exciting to hear, and hopefully a little bit of song from Schoolhouse Rock, I'm expecting. And then we'll hear from Stephani Becker, who's a senior policy specialist from Sargent Shriver National Center on Poverty Law, who's going to be talking about the provisions in the Affordable Care Act and how the Republican plan impacts those. And then we'll move on to our advocacy portion, where Maxx Boykin from AIDS Foundation of Chicago will talk about how you can engage in advocacy efforts through telling your story. And Scott Cross from Organizing for America-Springfield is going to be talking about how to engage in town halls across the country and other opportunities for applying pressure on elected officials. And then we'll hear from Kathleen Winters, who will talk about some of the work that she's doing within Champaign to really mobilize folks to save the ACA. So without further ado, I think we're going to turn it over to Mr. Rabbit to lead us through a bit of a Civics 101. Dan?
Sure. Thanks, Jessica. And hello, everybody. It's so great to see so many people on the webinar and so many people clued into this issue. I know because of the webinar, I'm not really sure who's logged in. So at the start, I apologize if this is not necessary for everybody on the webinar to go through Civics 101, how the bill becomes a law. But we want to make sure everybody's starting from the same page. And, you know, in order to understand the strategy that we're going to be implementing over the next couple weeks to save the Affordable Care Act, we kind of have to start here with Schoolhouse Rocks, as Jessica mentioned. Unfortunately, I will not be singing the song. I will spare you guys that, but thought we could start here at, I think, what many of us on the webinar grew up understanding was the process of how a bill became a law. If folks remember this cartoon that's pictured here, it states that a bill starts by being introduced in committee, and then being heard in committee, debated, passed out of committee, goes to the floor of the chamber, either the House or the Senate. It's voted on there, goes over to the next House, committee, floor, and then goes to the President. Kind of straightforward. But I think if anybody's been paying attention lately to how things happen in Congress, this is not normally how it goes. So, well, I think how it looks more often looks sort of like, next slide, please. Sort of like this, sausage making. This is President Obama here when the Affordable Care Act was passed 7 years ago almost now. And you can see all the papers cluttering his desk that show all the issues that people had with the process through which the Affordable Care Act became law. That it was rushed, that it went through this arcane process called reconciliation, that there were backroom deals, that it wasn't an open committee process. And I think what you'll see as this webinar goes through is that the Republican ACA replacement bill, the American Health Care Act, is doing all of these things regarding process, but maybe, you know, on steroids. Next slide, please. So you guys might have noticed there was an election. I think this is probably the place where we need to start. Republicans won or maintained control of both the Senate and the House, and of course also control the administration. You can see the breakdown here for the 115th Congress, the Congress that started in January. And clearly there's more red than blue. This particular picture came out before all of the elections were decided. There were a couple of very close ones. But right now it's in the Senate, it's 48 to 52, so 46-2. Those two independents, one is Bernie Sanders and one is Angus King, and they both vote with the Democrats typically. So it's 48 Democrats to 52 Republican senators. And that's really important because Republicans have enough votes that they can pass bills out of both houses in theory without needing any bipartisan support. But the Senate's a little different. You guys might have heard of the filibuster. And I think the first thing that evokes is Mr. Smith Goes to Washington, where people are down on the floor speaking about an issue they're passionate about, and that a vote can't happen until they stop speaking, so they keep speaking indefinitely. That is a filibuster, but these days there's a different kind of filibuster that is much less difficult for a senator to employ. That is basically you can put a hold on a vote and require a 60-vote, what is known as a cloture vote, to end a filibuster. And you can require that on anything. You can require that on a bill moving from committee to the floor. You can require that on a bill they're seeking full passage of. And what that essentially does is means you need 60 votes in the Senate to pass almost anything these days. And that's really important because there are not 60 votes, 60 Republican votes in the Senate. And that's going to lead us to why this bill, the American Health Care Act, is not moving through the order that we remember hearing from Schoolhouse Rocks. Next slide, please. So this is a more detailed version of Schoolhouse Rocks. It's color-coded. I put it up here just because I kind of showed just how hectic things can be to get a bill from start to finish in Congress. No one is required to understand all of these different points. It's actually even kind of hard to read on your screen, if depending on the size of your screen that you're watching it on. But this is just to show that it's hectic. But the essential things that you remember from Schoolhouse Rocks are there. A bill is introduced, the green. It's worked on in committee, the yellow. It's debated and amended and changed, the orange. The red is the budgetary effects are determined, and then it's voted on. And then it goes to the next house and goes through the same process, purple, blue, etc. Where we're at with the American Health Care Act is they've already pushed it through the yellow. So we're already in the orange/red period of that bill. And that's important because they're really trying to push this thing through really fast. And we need to know where the next points are in order to have a chance of strategically opposing it. Next slide, please. So that was how regular order goes. What they're doing for the American Health Care Act is what's called budget reconciliation. I think the most important thing you need to know about this is this red down at the bottom. You only need 51 votes in the Senate. That's essentially all you really need to know about it, but just for those who want a little extra credit, budget reconciliation was initially envisioned as a way to reconcile the budgets that the House and Senate passed that were not appropriated through the regular appropriations committees. It was not designed to be a method to pass giant legislation such as the American Health Care Act or the Affordable Care Act for that matter. But here we are now that most things require 60 votes in the Senate. It is often used to pass contentious legislation. And so with the budget reconciliation, they only need 51 votes in the Senate if all Democrats vote against it. So that means that they could pass it with just Republican votes, but they could only lose 2 Republicans and still be able to pass it. That's really important strategically. And so the process with it is you start with a budget resolution. That was passed in January. That resolution gives instructions to the relevant committees. The committees draft the legislation. That's what happened last week in the Energy and Commerce and Ways and Means committees in the House. They debated the legislation that was based on the instructions from the budget resolution. And where we're at now, next slide, is these next steps here. So the bills, what is known as the American Health Care Act, passed out of those 2 committees last week on a party line vote. All Republicans voted for it, all Democrats voted against it. And they passed all of that without a score that told you how much it cost or how many people lost coverage. And they're really rushing. What the next steps are is it now needs to go back to the Budget Committee to be combined into one bill and be passed out of that committee. And that's likely to happen as early as tomorrow, from what I've heard. Once it's passed out of committee, it goes to the Rules Committee. What the Rules Committee does is it determines how the debate on the floor is going to go. It limits how many amendments can be offered, who can offer them, how long people can talk, things like that. Once it gets kicked out of Rules, it will go to the floor, probably early next week. There will be a day or 2 or 3 of debate and amendments. And then this bill, the American Health Care Act, that Stephani is going to tell you more about, would leave the House and head over to the Senate, where a similar process would occur if changes are made, but it is still passed out of the Senate. Then the Senate version and the House version would go to a conference committee, just like Schoolhouse Rocks told us. They would iron out the details and send it to the president for a signature. So it is possible that this vote next week that the House of Representatives is trying to do is the last time this bill will be seen on the floor of the House of Representatives. So we really got to be ready because we only have, maybe only a week left. Next slide, please. So sounds like they have the votes locked up, right? They have enough Republicans in both the House and the Senate to pass this thing. Done deal, right? Not at all. This is where lobbying and advocacy come in. Now, lobbying often has sort of a dirty word, but all it really means is, advocating for your point of view. We've all been lobbying as long as we were babies crying for food, and this is going to be how we're going to slow this thing up. And I just want to put this here that this is the ball game, really. Next slide, please. And there's many different ways to lobby or advocate. We're going to go into some of these a lot more in detail as the webinar goes on. But I just want to put one thing in folks' mind. You see this picture here of a dude in a suit weighing pros and cons. Should I vote for it? Should I vote against it? Our entire strategy here is to make one of the 7 or all of the 7 opponents of the Affordable Care Act who represent Illinois, 7 Republicans from the state, to decide that it's in their interest to vote against this bill rather than for it. And there's going to be pressure to vote for it from their leadership, from their campaign promises to repeal the Affordable Care Act, from conservative interest groups are going to be pushing them to vote for it. And we need to make sure that they hear loud and clear all the reasons to vote against it. And that's why I'm so glad we're all here today, and so glad that we're all in this together. Next slide. So this is our goal. We need them to vote no on the American Health Care Act. We can use AARP's images. They're a member of the coalition. Hopefully they're cool with that. But this is really what it's all about. And so I'm so glad you guys are all here. And I'm going to pass it back to Stephanie to go into why it's so important that Congress vote no on this act.
Great. Thank you so much, Dan. Wanted just to give a second in case there's any clarifying questions that people had. If you do have a clarifying question, please do enter it in the question box. We'll take a 30 seconds or so for folks to enter those for Dan. If there are more discussion-oriented questions, we're going to leave those for the end. We've already received a couple through the question feature, so we'll be saving those for the discussion after the presentation. So thank you for those. But if there's anything that folks have in terms of clarifications, please let us know. Okay. Well, seeing none, we're going to go ahead and move on to Stephanie. And remember, please do keep those questions coming, and we look forward to the discussion. And so I'd like to turn over to Stephani Becker, who's Senior Policy Specialist at the Sargent Shriver National Center on Poverty Law. Stephanie?
Hi, everyone, and thanks, Jessica. So yes, I'm Stephani Becker, and for those of you who I met before and who know me, know that I'm the Affordable Care Act is near and dear to my heart. Been training on how to enroll people in it since the beginning. So I'm very passionate about this topic, and so I'm excited to talk to you today about the ACA provisions and then also about how the new GOP Repeal Bill or the American Health Care Act proposes to change those provisions. So I'm going to go through some kind of policy wonky things right now, and then we'll move on to some of the messages and infographics that you can use when you're communicating with others and your elected officials about this proposed bill. So first, just so we're all on the same page, here's just a one-page cheat sheet of the key features of the Affordable Care Act. So as you may have heard and know, it included a Medicaid expansion, which became a state option for adults that Illinois took, and it currently covers 650,000 low-income adults in Illinois. It also included a main feature of it was the marketplace, which included an easy way to compare insurance, and also included something called metal levels, like silver and bronze. And although the way most people understood that is that it was a way to compare plans, it also indicates how much private insurance covers the cost of those plans. So for example, just so you know, a silver plan, which most consumers pick, an insurance plan would cover 70% of the cost and the consumer would cover 30% of the cost. And that's important because we're going to hear about some changes to that. Another huge feature of the ACA is the financial assistance to buy insurance in the marketplace, because we know that's one of the main reasons why people were uninsured before. It was too expensive for them. So the ACA provided health insurance tax credits for people earning up to 400% of the federal poverty level, which is about $48,000 for an individual. And last year, about 335,000 people who were in the marketplace in Illinois, of those folks, 78% got tax credits to help with, to offset the cost of the premiums. Another feature of financial assistance is something called cost sharing reductions. And about 50% of marketplace enrollees get those, and that's to help with the cost of a copay or deductible. And the way the ACA tax credits work is that they vary with family income and the cost of insurance where someone lives. So the cost of insurance in Rockford is different than the cost of insurance, say, in Effingham. So the premium tax credits take that into consideration. And it also it takes into consideration someone's age, and it's set up on a sliding scale. So if a low-income person lives in a rural area with a higher cost plan, the tax credit would increase accordingly. Again, I'm only bringing this up because it's important when we hear about the GOP plan. There are also some key consumer protections in the ACA. There was an age rating limit instituted so that plans could only charge their oldest customers 3 times the price charged to their youngest one. And essential health benefits were included for all plans, including Medicaid and private plans. And this is what you think of all sorts of different things, prescription drugs and hospital benefits, but also some new things that maybe didn't used to be included, like mental health treatment, maternity coverage, prenatal care. So those were all included in under the ACA plans. And then the 2 last things I'll mention were the mandates, which became political issues. So the individual mandate requires that anyone who can't afford it to buy coverage, so that the insurance pool risk are sort of spread out evenly across everyone. And then it included an employer mandate. And remember, this is just for large employers with over 50 full-time equivalent employees. So they must provide health insurance to their employees. Okay, so that was a quick trip down ACA memory lane. And now here we are with the new American Health Care Act, or Trump Care, or the GOP Repeal Bill, which I'll kind of refer to it in all those different ways. But it does a lot of things to dismantle the ACA. So first, it freezes the Medicaid expansion, or that's what the language is, but it effectively repeals it. It does that by eliminating the enhanced federal funding that states get to enroll people into it. It also requires those in the Medicaid expansion population to submit eligibility renewal paperwork every 6 months just to stay on Medicaid. And for those of you who work with people who are on Medicaid, or if you've ever had Medicaid yourself, it can be extremely time-consuming and difficult to keep up with those redeterminations. So under the new law, or the new bill, I should say, states can continue to cover this group, but only at a regular matching rate. And that, coupled with these difficult redetermination requirements, will effectively repeal the program. Another way that Medicaid will be drastically changed is that it will be changed from a open-ended, federally funded entitlement program, and it will be cut or capped, so with reduced federal funds to the state. We'll talk more about this, but it can't be overstated how much this will really harm the program and harm people in Illinois. Because in order to make these cuts, you either have to cut Medicaid eligibility, benefits, provider rates, or likely all 3 in order for Illinois to meet its budget. The new bill also ends ACA financial assistance, including ending the cost sharing reductions, so no more help for the copays and deductibles. And it did institute a tax credit, but a tax credit figured out in a different way. So instead, the new tax credits are figured out by age and income, and they are from $2,000 to $4,000, and to buy insurance on the marketplace or even off the marketplace. And it would change the way the subsidies are distributed, and I'll show you that in the next couple slides, how that will impact people. Some of the other consumer protections are revoked. So now older people can be charged 5 times as much for insurance as younger people. so their premiums are going to go up, as you'll see. There's going to be a change in actuarial value requirement and removal of metal levels. So as I mentioned before, these metal levels were instituted to help people compare shop. That won't be the silver, for example, the silver plans won't be there anymore. But more importantly, it will not require them to have a basement levels, so to say. So they aren't going to be required to pay 60% or more of costs. In other words, they can contribute less for your copays and deductibles. And it will leave you, the consumer, paying more. Another consumer protection that is repealed is repealing the essential health benefits from the Medicaid expansion population. So not for private plans, but for the Medicaid expansion population, which could result in beneficiaries losing services such as mental health and substance abuse disorder services, which is very concerning. It also removes, as we thought it would, one of the most least-liked provisions by conservatives, which is the individual mandate, but instead it replaces it with something called a continuous coverage mandate. And this means that anyone who goes without health coverage for any reason has to pay a flat 30% late enrollment surcharge on top of their base premium for the next year. Also, unlike the individual mandate, where the penalty payment goes to the government through the IRS or the tax system, here the surcharge will go directly to the insurer's pockets. There's also no more employer mandate, meaning that people who work for larger employers may see their health care disappear. And it cuts funding to Planned Parenthood. So that's hugely important, especially for women in areas that are underserved areas or rural areas where they are the only provider. And as a trade-off for cutting all of these benefits, basically it wipes away all the ACA taxes that had helped to pay for these coverage provisions. And instead there will be a huge, a $600 billion tax cut for wealthy people, insurers, pharmaceutical companies, and others. So a whole lot of bad news in this bill. And not to be crass, but in every large public policy debate, there will be winners, there will be losers. And in this case, under Trump Care, the winners are younger Americans who will see their annual premiums maybe go down slightly, healthy people, high-income people, and insurance companies. And then the losers under Trump Care, and that's what we're going to focus on now, are older people due to that increased, what people are calling the age tax of 5 to 1. The 70 million people covered by Medicaid, including children, people with disabilities, and older adults who will see their benefits capped or cut altogether from the program. And then women who use Planned Parenthood for health services. Next slide, please. Here's a good summary by Kaiser on how the new tax credits would work. And not to belabor the point, but what I mean by who would lose out, you can see that the tax credit under the new plan does not vary by income, only by age. So for example, a 27-year-old who makes $20,000 gets the same $2,000 tax credit as the same 27-year-old who makes $75,000. So they'd each get a $2,000 tax credit. Next slide, please. Here's another way of looking at this. You can see that across the U.S. that tax credits will be worse for poorer and older people, noted by the pinker areas of the United States on this graph, and then better for younger and higher income people, noted by the green. Next slide. And here's a specific local example. The Kaiser Family Foundation has a great interactive tool that you can use to look up your county, and here's one from Champaign County. Here you can see that a 60-year-old earning $30,000 under this new plan would lose $5,480 in tax credits under the ACA repeal plan. And you know, in essence, that just might mean they can't afford insurance. Next slide, please. Yeah, this is great. So the other large losers in this situation are states and people who are on Medicaid. And there are 3 ways that it's going to be extremely harmful. As I mentioned, it's the ending of a Medicaid expansion that for us in Illinois would impact up to 650,000 people. And then it's the changing of the way that it's funded through a per capita cap program. And lastly, it's the fact that the essential health benefit mandate for Medicaid plans is being removed. And so states may be incentivized to cut optional services such as substance abuse treatment out of Medicaid. Next slide, please. So here's a way to show that also that the Medicaid cuts will impact every part of the state. So, and it doesn't just include enrollees, although that's who's going to be hit the hardest, but also hospitals and safety net providers are going to be hit hard. Some people may only think that it will hit, Chicago or Rockford or other big metropolitan areas the most, but actually, proportionately, southern Illinois counties and rural counties have a higher percentage of adult Medicaid recipients than others. So they may be hit harder than most. Next slide. So this is just, I won't go through this, but we're often asked, well, per capita cap sounds kind of good, and my legislator thinks it makes it flexible, for state funding. And here's just a good one-pager on why per capita caps are bad for Illinois. A cap means a cut. There's no other way around it. As an example, it will force states like Illinois to pay for the entire cost of an unanticipated increase in needed health services like the opioid epidemic or a natural disaster, or as the population ages, you're locked in to a cap amount. In addition, in Illinois, we have one of the lowest Medicaid enrollee expenses, and so we'd be locked into that, and that's why you'll see, Governor Rauner has weighed in and said that he does not like this proposal either. Next slide, please. So this week, jumping back to what happened this week, we got a score on the healthcare repeal bill from the nonpartisan Congressional Budget Office, or the CBO, and that's their job, is to rate legislation. And they too sort of became the latest voice in a growing chorus who say that the Republican bill will be a disaster. And here's why, or as Senator Dick Durbin put it, the CBO score is in and 24 million Americans are out. And that's the main takeaway and what we've been sending in our messages. The repeal bill will basically take away health insurance from 24 million people over the next decade, and then the number of insured could nearly double under this plan. Not only this, it will increase premiums in the next year, and also, as we've seen, have even higher increases to come, up to 700% for older and poor individuals. Next slide. So what have the responses been to the CBO report? I'm sure you've seen them all in the news and Twitter, Facebook. Here are some of the responses that I've picked. You can see ours in the middle. The Wall Street Journal responses on the left-hand side. Just from liberal to conservative journals alike, it is getting panned as just an awful bill in terms of how it hits people. We're starting to also hear from Republicans, a couple in Illinois even, who have expressed concern about the score and the impact on consumers, particularly in Medicaid. So we will be talking later about how we can capitalize on some of this concern about the bill. Next slide. So I know I've gone over a ton of information, but here are the four main takeaways I want you to remember about the GOP bill and what it does. Basically, it will cause healthcare coverage to plummet. It will increase out-of-pocket costs, particularly for older adults. The Illinois Medicaid program will be completely gutted, and for all of that, wealthy and special interests will get tax breaks. And we have some infographics there, which we can share with you too, just to put a dollar amount and a number amount on all of these profound effects of the bill. Next slide. Just another snapshot if you want to see that no one is spared. There's going to be more uninsured at every income and at every age. So President Trump's promise of covering everyone, we can clearly see will be broken. One last thought about why this is really bad for Illinois, and I've mentioned this, but just those of you who don't know Medicaid budgeting, federal funds make up more than half of state Medicaid budgets. So taking $880 billion out of state economies, including Illinois, will have a significant ripple effect, and every state will be hit at some level. So Governor Rauner joins other Republican governors around the country who are extremely concerned about what this means for their already fragile budgets. Next slide. So we have a lot of information about also how the repeal bill impacts specific populations, and here are some here: older adults, people with disabilities, working families, women, children. So we'll send you all of these resources for you to share and start getting the word out about it. And then the next slide, please. Here's a good list of quotes from people who know healthcare the best and why they think the Republican repeal bill is the worst. So, you know, oftentimes representatives will listen to doctors and hospitals and nurses, insurers even. At the very bottom, there's a quote from insurer saying it's going to destabilize the market. So you can use other people's words to show how bad the repeal bill is going to be on our constituents that we care about. And next slide is my last. Here's some resources for talking points, and we'll send these along, and also some PDFs that aren't online about how you can sort of turn these facts that I've given you into some real strong talking points, and I know that Maxx and Scott and Kathleen will share more about how to do that.
Thank you so much, Stephanie. That was fantastic. It's helpful to see, to do a deep dive into, you know, what the issues are that are facing us and the ways in which that we can respond to them. Before we move on to Maxx, I did want to just give a chance to ask one clarifying question that came in through the chat, and it was with regard to the removal of the essential health benefits from plans. So the person was asking, because they heard that, you know, Paul Ryan and other Republicans are disputing disputing the removal of the essential health benefits, and that they will, you had mentioned that they'll be removed from Medicaid, and the participant was asking whether or not they will remain in other plans.
Yes, that's a good question. So they, at this point, they do remain in private plans. That is correct. So they remain in private plans, and they is an option to remove them, or for states not to take them up in the Medicaid part of plans.
Okay, great. And then one other question, clarifying question is with regards to the definition of an older adult. What's the age range?
So it is, and I probably have used it a couple times, I think it's 55 to 64 or 50 to 64, and I will double check that.
Okay, great. Thank you.
Mm-hmm.
Okay, well, we're going to go ahead and turn it over to Maxx Boykin, who is the Community Advocacy and Social Justice Manager at the AIDS Foundation of Chicago, and my colleague, and is going to be taking us through a bit of advocacy basics. Maxx?
Thank you so very much, Jessica, and thank you, Dan and Stephanie, for kicking us off with Civics 101 and understanding how we got to where we are right now. Next slide, please. Really what I want to talk about is what's next. What can we do? And we've seen great things such as the marches, the Women's March in D.C. and also across the country that brought millions of people out to actually talk about like what's going on, how they can fight against these issues. We've seen a lot of different things go across the city, the state, and we want to continue to move that momentum to the next steps. Next slide, please. So what can we do now? Rallying is great. I know many people have had rallies across the state in front of their different offices, and that is important. But it is really important to make sure that we are getting organized through rallying, making sure that we're signing clipboards, coming to the next town hall meeting, going to the next whatever meeting that that we can continue to get ourselves organized, and keeping up with new policies and the education of things as they come in. Getting on this webinar is a great first step, but continuously understanding how these different policies that are getting moved, that we can continue to educate ourselves on how we can fight against them. And then supporting existing campaigns, such as the Protect Our Care Illinois campaign that is that we have kicked off. And don't limit yourself to one form of action. Rallying is great, but don't forget that you can also write letters to your legislators. You can do social media. There's many different forms of advocacy that we can use right now to make sure that our voices are heard. We can donate directly to resisting communities and people that are continuing to actively resist in this time, and then center the leadership of the most impacted. And when I say that, there are people that will be highly impacted, elderly, people with disabilities, people living with chronic illnesses. Those are the people that will be most impacted by the repeal of the ACA and the move for this current healthcare bill. And with that, we want to really center the people that will be most impacted by this. And please, for more information, go to the link below with this slide. Thank you. So what are the action steps we can take? We know voting and continuing pushing out people to exercise the right to vote is important. But there's also canvassing and surveying in your communities, talking to people, getting them engaged in this work, telling your story, which we'll get deeper into a little bit, and really having that chance to tell why your story is so important right now, and getting those stories heard. Phone banking, making sure that you're talking to people in the community. You know, I know it's snowing, and there's a lot of snow on the ground in the state of Illinois right now, so canvassing is not always the easiest thing, but continue to reach out to folks in your community. Going to community meetings, town halls that I know Scott will go into a little bit more, but making sure that we keep our legislators accountable to us, and continue to form coalitions such as Protect Our Care Illinois. But we've also got people from Indivisible, Action for Better Tomorrow, and different coalitions that are formed across the state. Continue to rally and then advocate and activate to make sure our voices are heard. So some of you may be asking, what is advocacy? Advocacy is defined as a public support for a recommendation of a particular cause or policy. There are many different types of advocacy to make sure your voice is heard. Self-advocacy, when you think of self-advocacy, many times when you're doing a job interview, or even when you're going to your doctor to tell, you know, what the things that you need, and why you should maybe get that job, or why you need access to better health insurance. Systems advocacy, changing a school system, or making sure that your park district has more access for children to go there. That's changing within those systems. And then you have legislative advocacy, which we're going to focus a little bit more on because this is a legislative fight. And that means speaking with your elected representatives federally and also locally to make laws and policies that support our communities. Our elected officials have the power to make these changes, and we want to make sure that they're speaking truth to this power. And when we talk about legislative advocacy, one of the most important parts is presenting your story to your legislator, and then talking about how these different policies or funding cuts can affect your everyday life, and then asking them to work on your behalf, because in the end, we do know that they do work for us. So there's different ways to advocate. One is setting up meetings with them. I know here at AFC we have a group of advocates going to DC at the end of the month to make sure that our federally elected leaders actually understand what it means to be living with HIV and AIDS, but also invite them to programs that we are having. You can also write them, email, letter, postcard, and especially a postcard after meeting them is a really important thing to remind them of what you were talking about and why it was important to get these issues out. And then calling. I have an advocate that calls literally his legislators every day on the federal and local level and reminds them that he will be coming down to meet with them very soon. And then last but not least, again, voting for them, because that is the way to keep them accountable. So for the Illinois delegation on the federal level, we have 13 Democrats, 2 senators, Richard Durbin and junior senator newly elected Tammy Duckworth, who used to be a House of Representative. We also have 7 current Republicans, including the 6th District, Peter Roskams, 12th District, Mike Voss, Rodney Davidson, the 13th, Randy Holgren in the 14th, John Shimkus, Adam Kinsinger, and Darren LaHood in the 18th from the Republicans, and the rest are Democrats. And most of the Democrats touch Chicago, but there are a few that are outside of Chicago in the state. For legislative districts for the state, for folks to understand, they're on the federal level. Of course, you have the 2 senators, and you have a House of Representatives that represents you. In the states, you have a Senate district, and then you have 2 House districts under those Senate districts. So for every senator, there are 2 House representatives. And then you have your hometown wherever you live in. I live in Bronzeville, south side of Chicago. My district level is Christian Mitchell, and my Senate district level is Kwame Raoul. So, and just understanding where all these, and that's different from on the federal level, I'm represented by Danny Davis, and then 2 senators, Senator Dick Durbin and Senator Tammy Duckworth. So understanding that there are multiple levels in which people are impacted by this. Right now, this is definitely a federal level thing that we're working on, but also to understand that this will impact the state, and this will become a state fight as well. So how do we get this all out to our legislators? How do they hear about this? And one of the biggest pieces of the first part is telling your story. For me, healthcare is very important. In 2007, I lost my aunt who had cancer for 4 years, but she didn't die because she didn't have the funds, she just didn't have health insurance. She didn't have access to actually having health insurance in her state to make sure that she could pay for this. And then in 2015, I lost my uncle again because my uncle in 2015 in Alabama because they did not have Medicaid expansion. I have also seen, so I've seen 2 family members die without having access to health insurance. I know how that has impacted my mother, my community, and my family directly, and even my 3 cousins who no longer have their mother in their lives. Right? So these are things that we understand, and I think everyone has a story. Everyone, all the clients that people work with, the different agencies we work with, and then every human being has a health story that has impacted them, either having greater access because of the Affordable Care Act or not having access at all, and having that taken away now with a bill that is being pushed on the federal level. You know, how do we get used to this? We have to practice. One of the big things that we do is we try to make sure that people have the access to the fact sheets and infographics. We'll continue access on the Protect Our Care Illinois website, but you have to practice. I practice in the mirror, and for me to be able to tell this story, and especially stories that impact, that are, you know, talking about either deaths in family or people that have lost important things because of not having access to health insurance, it does take practice to be able to get that out rather quickly when it deeply impacts you. So making sure that you practice. But also when we're telling our story, we want to offer solutions. What we're talking about on the federal level, we're talking about not passing a bill that will take away 24 million people's health insurance, but actually continually making the Affordable Care Act better to make sure that people don't have health insurance continue to have access to it more. But also to remember, when we're talking to legislators, we have to keep it short. And when we talk about keeping it short, most legislators are only talking to us for the longest 5 minutes, for most times a minute or 2. So making sure we can get that story out rather quickly, talk about why it's really important, and then moving on to, like, what is the next step and solution that we can do. And one of the main things that we're pushing for is not to pass this current bill, but to, if you want to do anything, make the ACA better so more people are covered. And then a big part after we're talking about our story is the ask. When we're talking about the ask, you have to talk about how your story will illustrate why it is important to you, why it's important to make sure that it gets out there. But then on the next side, you have to talk about why this story is humanizing and why this legislator has to understand why this is really important, and directly ask them to count on their support. Legislators, we want to make sure, and also it can be okay if there's an awkward silence. That is all right. Make sure that they understand that you're not taking no for an answer here, and you want to continue to push them. And it is important to thank them for their time, but also to make sure that there will be a follow-up. I like to say, you know, if they can't give you a direct answer that day, say we will follow up next week, or we'll follow up in the next day or 2. And that's where again, going back to the piece about writing them, making sure that you're emailing them, the follow-up is also really important, because you may not get a direct answer that day, but that continued pressure will continue to make sure that they understand that you're here, and you're here to make sure that we get continued access to health insurance. And then when we talk about how do we talk to legislators, we have to remember that they're people too. Here we have Representative Adam Kinzinger, Representative Danny Davis, and then Senator Tammy Duckworth. These are people, and they also understand that there are millions of people that have access to health insurance because of the Affordable Care Act, and that the continued people need to have access to it. So what do we want to talk to them about? We want to talk to them about how access to health care and health insurance have helped you in some way in your community. But then you also want to talk about how others have benefited from the ACA, and repealing it and replacing it with a worse bill, it would be how much it would harm just not you, but your community. And one of the big things I tell everyone when we're talking about this, remember that you're telling them that you live in their district, that you vote in their district. That is, make sure that they understand that you are an important piece to this. And push for them not to vote for this bill, which will leave less people with care, and talk about what the positive things will continue to happen if we continue to put adequate funding to health, to making sure that people have access to health insurance and health care in this country, and keep people protected. Next, we're going to go a little bit into digital advocacy, and with the current way in which things are, and the current president who loves Twitter, digital advocacy and using social media is a very important piece. So we want to make sure that you're including others, tag your legislators, and one of the things I like to tell people is if you tag your legislator, it's much like if you tag an airline. They don't like bad press on social media. They don't like that. So making sure that you're tagging them, keeping them accountable, Tag other key advocates that you know so they can get along in the fight. Organizations such as the AIDS Foundation of Chicago, Protect Our Care Illinois, and the many people that are part of our coalition. And then tagging the media as well, because we want to continue to put media pressure on these legislators, and especially on a local level of, especially if you're doing this in Springfield or Peoria, doing that to make sure that people understand, okay, the local media outlets will cling on to this and actually put your tweet possibly on the 5 o'clock news. And that could be really helpful in making sure that this gets out there more. Retweet and favorite other messages that you see. Use the hashtags that we have on social media. And an image is worth 1,000 words. So posting great images of people in the community and why this is important to have access to health insurance is important as well. We don't always agree, and that's a real thing. But always respond to folks. Don't unfriend and follow. This is a great education tool to let people know about what it means to have access to health insurance. And we're trying not to delete comments, especially if we're posting things on Facebook. And make sure that you're doing some unique content. Again, having cool pictures with things is important. But beware of trolls. So when we say don't delete comments and other things, if people are trolling, being disrespectful, that is completely different, and definitely delete those type of comments and move on from that. That's it for me. Jessica?
Great. Thanks so much, Max. That was fantastic. And we've had some really good questions that have come in through the chat that are going to be more for the dialogue that's going to be happening a little bit later. So we're going to put a pause on those. And want to turn it over to Mr. Scott Cross to talk about town halls and taking advantage of those. Scott?
Thank you, Jessica, and thank you to Dan, Stephanie, and Max. I just wanted to make sure that we have a plan for our upcoming town halls and teletown halls, as along with the basics of how to call your member of Congress. So, next slide. When you're calling your member of Congress that are back in the districts for congressional recess, many will hold public town hall meetings or listening sessions, office hours. These events are opportunities for you as constituents to interact directly with your member of Congress. And that's what the MOC will stand for, in case you have questions. Their staff, you want to ask questions about where they stand on the issues, share your concerns, and press for answers on policy proposals and legislation, and get their stance on upcoming votes. So first you want to find out about where the town hall meeting will be. This is important. A lot of members of Congress are kind of pushing back things, so you want to sign up for their email list if you haven't signed up for their website to be a subscriber. And also you're going to want to sign up if they have an option to sign up for a teletown hall. The next slide. So what you want to do is you want to be prepared first for the town hall. We don't want to wait until the member of Congress will be holding a public meeting to prepare for it. In fact, preparing for public meetings now means that you'll be better able to execute your plan as to find out where the public meetings will be held. So form a group of fellow constituents. It can be you getting tapped into one of the groups statewide that are happening, such as Organizing for Action, Action for Better Tomorrow, Indivisible Citizen Action. There are many groups. Or you could just form a group in your local community of 5 to 10 people, get together, and talk about a strategy to amplify your message and show the community the issues that you care about. We say that you want to particularly hone in on one issue for your meeting. You want to distribute a list of those questions. So you have the meeting, you sit down, you guys develop a list of 10 questions that you're all on the same page with that are targeted and they're policy specific. For instance, we want to, in this particular iteration, we want to focus on questions that are policy questions for Obamacare. You want to fuse these policy questions with specific things about that are, the specific policy, but also that are personal to you. As you heard earlier, people talking about the power of your personal story. It's a powerful organizing tool that helps us connect with our member of Congress so that they look in our eyes and they hear our voice. And that's one of the things that moves them. And you want to make sure that you have a plan when you're going to this town hall meeting, that you're all going to, show up, meet before, and kind of get together, have the strategy ready. You're looking for a commitment. You want to have these questions be pointed and end with a question asking about a commitment from your member of Congress. For example, will you commit to not take away health insurance from 24 million Americans, including thousands right here in this district? And determine the roles of each of the people in your group that are going to this town hall meeting. You want to make sure that someone's going to record the meeting on video with pictures and on Facebook Live. Then determine who will use the social media to reach out to the press and others and what's going on inside the town hall meeting. Make a plan with backup roles ahead of time so everyone is clear on what their role is during the town hall meeting. And remember, take video, pictures of the event or it did not happen. Post these pictures and videos to social media throughout the town hall meeting. Next slide. At the town hall meeting, you want to get there early. These town hall meetings fill up fast. Meet with your, sorry, go back one. These town hall meetings fill up fast. Quickly review the questions you'll ask and the roles that people will fill. Spread out. So if this is an in-person town hall meeting, you want to go in pairs or split out or across the room. Make the perception of a broad consensus a reality for your member of Congress. It also maximizes your chance to get a question answered. Applaud when someone in your group or another person with a question that aligns with your issue asks a question because you want to show wide support. For in-person town hall meetings, we do not recommend that you bring big signs. You want to steer clear of anything like that because you have a less chance that the member of Congress staff will hand you the mic. So you want to look friendly and neutral. And the same thing goes with T-shirts. Look as neutral as you can. Stick to your script, the questions that you worked on as a group, feed off one another. Stick to these questions so the strategy for getting the questions answered can play out as fully as possible. You can even read it straight from the list of questions that you have. We also want to make sure that you're respectful but persistent. It's your job to get the questions answered from your member of Congress. And in some cases, they might dodge your question early or they might want to give you only a half answer. You should always be respectful, but call them out if he or she is dodging your question. Hold on to the microphone until they have answered your question. Big point, hold on to the microphone because you can press them back and say that you deflected my question. And finally, record everything between the people in your group and the MOCs if the law allows it. You know, having a video of a member of Congress answering a question in their own words is one of the most impactful ways to move your issues forward. And interaction can be picked up by local and national media and spread throughout social media as well. Don't forget about Facebook Live. It's a powerful tool to bring the action into a town hall in your community and into the press. And don't forget the hashtag #ProtectOurCare. So after the town hall meeting, you want to share what you heard. This is where you show the momentum we have on this issue and our protection of the ACA. Provide your account of what happened in the town hall meeting on social media, including Facebook Live. You should also tweet, post to members of the press, to your member of Congress, and other supporters on this issue. Again, hashtag #ProtectOurCare, it's really important. Next slide. So now we're going to move on to the Telecon Halls. Now this is something new that is new in this alliteration, and they're happening fast. We have very little notice. So the first thing you want to do is have a community action plan or a group action plan, a place where you can all meet once you get notified that there's a Telecon Hall. From the experience we've had with both Rodney Davis and Representative Darren LaHood, they give us less than 24 hours or 24 hours notice. So it's important, again, to have a community action plan or a group action plan, a place that you can organize and to come to a predetermined location, call the press and the public, have constituents ready to respond with letters to the editor. And a big tip, training your community, training organizations, and training other people. Make sure that your questions that you're asking, you punch in right away. That's one of the big tips. If you could get on a Telecon Hall, make sure that you punch in right away with the question. As soon as the second that they tell you, push #3, do it. If you get a chance to ask your question, they'll put you on a private line. They'll ask you a question. Ask a very basic and generic question, and you can target it if you get the chance to ask your member of Congress. When you do get on the call, make sure that you're firm with your questions and very nice and polite. And one of the biggest trainings that we can teach people about what we've experienced on Telecon Hall is if you are waiting for your question to be asked and you hear a caller before you get their question deflected or not answered, do not feel afraid to say, I was going to ask a question about tax reform. However, sir, I noticed that you deflected the last caller's question, and I want to restate it and re-ask it. And I think that all of us on the call would like that question answered, especially if it's very dear to the issue here with the Affordable Care Act. We want to make sure that we're getting those members called out. We're getting those members to answer our questions specifically. Next slide. So now I'm going to talk really quickly about just the basics of what you do when you're calling your member of Congress. You just call their office in D.C. is the most recommended one. You want to talk with the staffer, you first have to identify yourself as a constituent and a concerned voter. Give them your full name, your address with zip code, if you know the last 4 digits, and you're in a split district such as we are down here in Springfield. That will help them to get it up and running faster for you. You want to identify the issue that you're calling about. Next slide. And we recommend that you have the points that you want to go over with them. For instance, my name's Scott. I'm calling to urge you to save the Affordable Care Act. You know, it's Obamacare, and we don't want you to vote no on its repeal. And the reason why is because I think that people with pre-existing conditions should have the same plan and enjoy the subsidies that they do now on the Affordable Care Act. 2, you want to urge your member of Congress to vote no on the American Health Care Act, currently before Congress, that many people are currently calling Trump Care. And your reasons why: because 24 million people will lose health insurance by 2026. 3, you want to urge your member of Congress to commit to an in-person town hall before any vote to repeal or replace. As we talked about the trainings for the Telecon Hall and the town hall, this is your way to actually, have your voices heard. They serve us, the people, and we want to make sure that our voices are heard on something so profound as our health care. Personalize your message, localize your message, and if you have a family member that makes a separate call with you, have them, don't both of you get on the call, make 2 calls. If there's 3 voting member ages, make it a family affair, get everyone together and make the call today or make the call tomorrow. We need for people to be calling the members of Congress that have not and reaching out to your family, friends, and neighbors in the coming days. Next one. And finally, get tapped into statewide actions that are happening across here in Illinois. We have rallies happening. We're excited. It's the 7th anniversary of the Affordable Care Act. There are rallies happening in every district of the state. We're going to get you an email following this so that you can get tapped into those. And make sure that you're talking to members, or friends and family, and take a friend along with you. Make sure that you're calling your representative. Make sure that you're scheduling your constituent visits. A good best practice, if you do get a constituent visit, first of all, at current state of affairs, you need to go to your member of Congress's website, find the link to request a constituent visit, and that's the fastest way to get it from them. Do not call them about the constituent visit, request it through their website. It's one of the fastest ways to do it. To write a letter to the editor, and write a letter to your member of Congress, and then turn it into a letter to the editor of your local newspaper. Also make sure from what event, what action, and everything that you're doing, that you're sharing pictures on social media, Facebook Live, Instagram, and Twitter. And remember the hashtag #ProtectOurCare. We want to make sure that we hold our members of Congress accountable. We want to make sure that they understand the issues that are important to us, because remember, they serve us, we the people. So in closing, just remember, one of the things that your member of Congress will move on an issue if they hear your actions and your voice. They see you in the street. They hear you on the phone. You stop by their office. These are the things that will help us save and defend the Patient and Protection and Affordable Care Act. How do we do this? By organizing your group and by organizing your community and having your voice heard. Thank you, and that's it. Back to you, Jessica.
That was great. Thank you so much, Scott. A couple of things that I wanted to note. So we're going to be the questions that have come in about other resources that are going to be made available in terms of connecting with other advocates and community events, as well as resources to reach out to the media. We are going to be making a number of those resources available on the Protect Our Care Illinois website, so please be sure to check those out. Those will be up by the end of the week. And then the other piece is that we'll also be sending out a number of resources as a part of the follow-up from this webinar. So now we're going to hear from another voice in the field, Kathleen Winters, who is with the People's Agenda-Champaign, and is going to be speaking to us about some of the work that she has been doing in Champaign-Urbana. Kathleen?
Hi, everybody. It's really nice to be on this webinar. So my name is Kathleen Winters, and I am a grassroots volunteer that we've heard a lot about since the election. I'm professionally a freelance musician. I am a graduate student at the University of Illinois, and like a lot of people in the Champaign-Urbana area, and I think actually nationally, I'm one of those people that's never done anything like this before. So I think this is an area that offers a lot of positivity in a time that's overwhelming and maybe a little negative. So I wanted to talk to you a bit about what some of us in CU have been doing. So let's go on to the next slide. Okay, so along with this idea of positivity that's happened in the dark days since the election, there's been a big surge in new interest in advocacy from just regular old citizens across the country. And in CU, this has led to the formation of a bunch of new advocacy groups in the months since the election. So the first one that I became aware of was Action for a Better Tomorrow. This is a group that came out of the Pantsuit Nation pro-Hillary group on Facebook, and it sort of was a ready-made built-in system of people who had the same concerns about the same issues. So here in Central Illinois, that has morphed into the Action for a Better Tomorrow East Central Illinois Voices. And this group does a lot of action items, a lot of organizing phone calls, letters to the editor. And we also have done some in-person events, including a letter campaign about personal stories of the ACA to our members of Congress, which in this area mostly is Rodney Davis and Darren LaHood and John Shimkus. Unfortunately, they are all very much repeal and replace people, but we did bring 120 letters to Rodney Davis's office back in January, and Rachel Maddow picked up on that, and we got a little bit of national attention. So that was pretty cool. CU Indivisible and Indivisible 13 are both groups that are working off of the Indivisible Guide. CU Indivisible right now has about 1,100 members, which is pretty cool, and they're doing some great work with letter to the editor campaigns and other things like that. Listen Up from District 13 is specifically geared towards flipping the District 13, which is Rodney Davis's district, in 2018. And that group also has about 1,100 members on Facebook, and we're trying to lay ground game for future 2018 elections. So the Illinois 13th Congressional District constituent draws from a lot of these different groups and was sort of a focal point in a town hall about the ACA that we recently had, and it's sort of a place where varying people with various interests can get together specifically about the 13th Congressional District. And finally, the People's Agenda, which is what I'm here representing, is not a new group, but it's definitely been reinvigorated. It is a group, a progressive advocacy group in Champaign-Urbana specifically, that currently is focusing on local issues, hoping to spread progressive values and get progressive candidates elected in the Champaign area, and then from there branching out into districts and hopefully state and then national issues. Okay, if we can go on to the next slide. So here are some examples of events that have come out of these groups since this is just since January of this year. So like I mentioned before, the Action for a Better Tomorrow Affordable Care Act letter initiative was really successful. We had over 100 letters that we delivered and had about an hour-long meeting with one of Representative Davis's members. The Women's March CU was organized by several of these groups. I myself led a sit-in at Representative Davis's Champaign office to urge him to get rid of a falsehood that he was printing in his form letter responses to constituents about the Affordable Care Act that referenced the old death panels narrative that seems to refuse to die. That was successful. He did remove that passage from his letter. And we also got him to say on the radio live that he will not hold an in-person town hall. Obviously that's disappointing, but it was the first time that he would commit to a yes or no answer to that question. So we're very excited that we could at least get him to answer the question and then formulate strategies around that. So the strategy that formed was a town hall series that we are planning around the district. It kicked off back on March 5th with a town hall about the Affordable Care Act with a great set of panelists who gave some really interesting information. It was a bipartisan event. It did lean a little progressive, but there were definitely dissenting voices represented on the panel, and it was a really successful event. We are currently pushing to revitalize and help reinvigorate local Democratic parties. For example, the Champaign County Democrats currently have a ton of vacancies in terms of precinct committee people, so we're working to find volunteers to run as precinct committee persons to help with the ground game going into 2018 in terms of getting out the vote. And finally, the People's Agenda is doing a lot to educate. So we've had some education about local elections that are coming up. We have a nursing home initiative that we're working on, and also some Affordable Care Act initiatives in terms of educating our local public. Okay, next slide. One of the other things that's, I don't know if people around the state have heard about that we're doing is a Where's Rodney campaign. Rodney Davis is famous for not appearing in person in the district, whereas his predecessor, who was also a Republican, was very available to constituents. So that's something that we're hoping we can capitalize on, both about the Affordable Care Act and going forward to hopefully flip the district in 2018. So Louise Dixon of Dixon Graphics was kind enough to print 4 life-size cardboard cutouts of Rodney Davis with a little poster saying, "Where is Rodney?" And he's been making the rounds throughout the district, and it was a really successful social media campaign that drew attention to the fact that he's not willing to speak in person with his constituents about the Affordable Care Act, and that helped draw attention into our town hall series that kicked off last weekend. So he'll be a fixture over the next 18 months as we work to flip the district, and we're hoping that this idea might catch on in some of the other districts in central Illinois that may be vulnerable. Okay, next slide. So like I said, I'm brand new to advocacy myself. Prior to November 2016, I was just a flute player, and now I am a flute player on a webinar call. So how can fellow people like me become more involved in this process? So one of the things that helped me a lot was just reaching out and connecting with like-minded groups in my area. It empowered me to realize how much change I can affect personally, and it also was reassuring to see how many people actually feel like I do about a lot of these issues and are interested in trying to get something done. Another great tip would be to choose just 1 or 2 issues that you feel really passionate about. It's easy as a new activist to try to take on too much at one time and get burned out. I've seen this happen with a couple of friends already. So pick 1 or 2 things that you think are really important and hammer away at those, and then if you feel like branching out from there, you definitely can. Another thing that is really helpful is to schedule and make a pledge to yourself to call your representatives at least once a week. I have this in my Google Calendar. It pops up every Monday and reminds me who I want to call and when I'm going to call them. It's easy. It's easy to do, but it also can feel a little intimidating. So if you have that scheduled pledge to yourself, it's a little hard to weasel out of it. Another thing you can do to help with that calling is to keep a list of items that you feel are important to call about, and that way you can check off when you've called them. If you also can use some of these action items from these local advocacy groups, they will help you keep track of when bills are coming up to vote at all levels, national, state, and local, and you can be aware of when you can time your calls the most effectively to make sure that your voice is being heard about each of those bills. The third thing you can do to make this easy is to add your local, state, and federal representative to your actual phone contact list. That way you don't have to look up the phone number every time. You can just, it's time to call Rodney Davis, click on his name, and there you go. Okay, next slide. So based on some of the things that we've done, it can seem to a novice that it would be very difficult to plan an event, but it actually isn't. So if you go back to that sit-in that I hosted back in February, that I didn't even actually intend to be an event. It was just going to be myself going and sitting in his office, and I ended up having about 40 people come throughout the day keeping me company. So all you got to do to have a successful event is consider how the date and time that you're planning is going to affect attendance. If it's in the middle of a work week, you might have lower attendance, but that's totally fine depending on what you're trying to do. you also need to ensure that your event has a specific message. This is something that I was really intent about with the sit-in. I was afraid it was going to turn into a free-for-all, you know, we hate Rodney Davis or something, which is not what we wanted. So we kept all materials very specific to the line in his form letter we were trying to get removed and a yes or no answer to the town hall question. So along those lines, try to keep in mind, are you trying to achieve a specific result? Or are you just trying to draw attention to something, maybe to your group, to a specific issue, or to something else? And then craft a press release with all of those considerations in mind, with that really specific message and with the result you're trying to achieve. And send that out to local media. And it was really helpful to us at the sit-in. We had a local CU online magazine, Smile Politely, came out and did a piece about the sit-in, and we had our local CBS affiliate came out and did a piece, and that generated a lot of great follow-up. And so finally, cross-post the event with other local groups so that you can increase your attendance and your reach, and then follow up with the press after the event. We were able to generate about a week and a half of local media coverage based on the sit-in with just minimal effort, honestly. Okay, next slide. Finally, doing something, even if it's small, is absolutely better than doing nothing at all. I know a lot of people on this call may be like me, and maybe somebody who's completely new to this process. I think it's hard to know what your effort is going to achieve in the long term, and so, you know, things that you think may be insignificant really will snowball and have a big impact down the road. So pick up the phone, call your member of Congress, attend a meeting. Any of those things are going to be helpful. And yeah, I think if we all just pitch in a little bit, it's going to have a lot of impact down the road.
Great. Thank you so much. So I think we're going to go ahead and jump into questions here. I wanted to take a minute we've had a number of questions come up with regard to different policy issues as well as some specific advocacy ones. I want to start off with a policy question that I want to throw to Dan. The question was about how is Congress able to eliminate the actuarial value rules through the budget reconciliation process?
Thanks, Jessica. That's a really good question. It's not clear that they can. For background, budget reconciliation is only supposed to be used for policies that affect the federal budget in terms of spending and revenues. And the actuarial values is really more of a regulation of the insurance market. So a case could be made that that impacts the federal budget in some ways because it impacts how subsidies are paid out maybe, but it's a bit of a stretch. So some people have wondered when and if the American Health Care Act gets over to the Senate, which is where they enforce those rules around budget reconciliation, and having to be related to the federal budget, whether it would survive. So Democrats in the Senate are likely to call that into question, call a point of order on that, and ask the Senate parliamentarian, who is like the rule keeper around this issue, is like if it really does affect the federal budget. And so we could see parts of this need to be stripped out, or who knows what. But it's a very good question.
Great, thank you. And then, Stephanie, I was wondering if you could speak to the issue regarding the proposed legislation's impact on the Medicare Part D. Specifically, the person's looking to know what the impact would be on closing the donut hole.
Yeah, so that was a really good question. I did not know the answer to it, but then I just looked it up, and it says it does not touch that provision in the ACA. So that's, you know, there were a couple things that it didn't touch, and that is one of them.
Okay.
So that will be protected.
Great. And then this question I want to throw to Scott and to Kathleen. People are wondering a little bit more if you could talk a little bit about what you can do whenever a legislator refuses to hold a town hall meeting. What are some of the additional actions you could take?
Yeah, so here in Illinois 13, that's exactly what we're facing. Rodney Davis is flatly refusing to host an in-person town hall. So we took it on ourselves to host a town hall without him. We invited him to it. He, of course, declined it. But I think hosting those events educates the public, but it also is a really effective media strategy to bring negative local attention to that representative refusing to host a town hall, which in the end is really going to hurt them. Yeah.
Yes, and there's another thing you can do too is look for, you sign up for their email list, look for and put your kind of ear to the floor to hear for optical events. And when I say optical events, these are events that your member of Congress come into a district lots of times on the weekend, and especially the upcoming congressional recess, to find them when they're speaking at an opening of a different place, talking to a local group, and be outside. In that type of case, you want to catch them, and you want to be there with your signs, and you want to have the same colored clothes on, and you want to try to get them to ask a question, get that question that you want answered on a specific policy issue. An example, we were outside of office hours for Rodney Davis here in Springfield. Normally he does come to them. They kind of spun it and said they're mobile office hours, and so he only comes to regular office hours. And we got, just with 12 people, we got a hit on the local news that let it by. Why is Rodney Davis hiding? So don't think that just with a few amount of people that you can't make a dramatic impact.
Yeah. Hey, this is Dan. If I could just add one other thing. In the next 2 weeks, it's likely that we're not going to get a town hall from supporters of the American Health Care Act. So definitely just following the ideas that that Scott and others have shared is one idea. But just going to their district, making phone calls, I think those will be effective tools as well. So don't get dissuaded just because we can't get a town hall or you can't get in front of the member themselves.
I have one final thing to add about. Oops, sorry.
No, go ahead.
I have one final thing to add. This is Kathleen one more time. Also, if you are trying to get a little bit more in depth than just calling and hearing the staffer say, yes, I'll pass your message along, you can go personally into the office and ask to talk to staffers and hold their feet to the fire a little bit more to press them for actual thoughts from your representative. We've had some success doing that locally here with Rodney Davis, so that's always an option too.
So we've actually had a number of questions come in from folks that are in blue districts and are wondering what they can do to continue to sort of boost the support among them and to really lend additional support to activities that are happening in other districts where more advocacy is needed. I kind of open that up to the group because I think there's a couple of different perspectives on that. I'll toss it to Max first, maybe, to take that one, or to Scott. That's fine.
Sure. One of the things I would say is if you're in a blue district and you want to help out the most, there are going to be rallies happening outside district offices on the anniversary. Connect with a group in that district that's hosting, which would be Indivisible, OSA, People's Agenda, Action for Better Tomorrow, and bring your people to that district and show them the support. Another way would be to organize phone banks so that you can call into those districts to alert, such as Shimkus, Kinzinger, and Roscom, that you can alert their constituents to make the call to save the ACA. That's one thing.
Another thing that you could do is, anyone can write a letter to the editor, and you don't have to be the person that submits that letter to the editor of a newspaper. One of the things that we're working on with the People's Agenda is a sort of a system where people can upload letters to the editor that anyone who wants to submit one can easily download and submit in their name to their newspaper. That can be a really effective way if you can generate those letters. If you find that you're a good writer and things like that, it can make that process go a little faster when we realize, oh, you know what, the local paper in Danville hasn't had any letters about the ACA and we need one really quickly. That can be something effective to do too. So you can contact these groups downstate or in the more red areas of the state and ask if that's something they'd be interested in.
I'm so glad you mentioned that, Kathleen. That's actually something that we actually have a number of resources to support people with as well. We have some different talking points that can be used, as well as a few templates for letters to the editor that we'll be making available after the webinar as well. And I think, too, the other piece I want to just make a plug for is that there's individuals who are interested in telling their story and wanting to talk with the media and have a compelling story to share, to please contact us, and that's something that we would love to collaborate with you on. One of the other questions that came through was about advocating not just with the House members, but also advocating on the state side. And what are y'all's thoughts on really focusing some attention on Governor Rauner was one piece, and then another question that came in that's related to this is also the engagement of other types of organizations and individuals to bring new partners into this work to increase visibility as well as public pressure.
This is Dan. And we have definitely met with a number of staff from Governor Rauner's administration, and he is a target. He has a lot of influence on the Republican delegation in Congress, and so that's a very good idea, and it's something that we're pursuing. I would say that's another thing that anybody from anywhere in Illinois can do is you can call the governor's office and you can let him know that he needs to take a stronger stand in opposition to the American Health Care Act. In terms of reaching out to non-traditional partners, we would love to do that. If folks on this call or on this webinar have ideas for organizations that we might not have thought about in terms of partners in order to save the ACA, we are all ears.
Yeah, so I think,
thank you, Dan.
Thank you, Jessica, for that piece. I think continue to put pressure on state legislators is going to be really important, and this will definitely become a statewide, but concentrating that is a federal priority right now. And even have your local legislator, and even going back to have your local legislator reach out to those folks, encourage them, even if they are on your side, to continue to push the other legislators that they work with or with every day, to continue to push them, and be very outspoken in the media as well on why they need to keep having access for the 24 million people that could lose health insurance with the path of this bill.
So I want to be mindful of time because we are at 1:30, and so wanted to hand it back over to Max to talk a little bit about a couple of the other things that people can do as part of follow-up and some of the resources that we have available. Before I do that, though, one of the things, there was an additional question that came in about 501c3 statuses for nonprofit organizations and their ability to engage in this work. And I did want to note that the Protect Our Care Illinois Coalition is a nonpartisan entity, and the overwhelming majority of the organizations that are a part of that group are nonpartisan and have 501c3 statuses and are able to really engage in a lot of advocacy work. If you have specific questions about what you can do as a nonprofit, there are a number of resources that are out there, including Alliance for Justice, which has a whole range of materials and fact sheets, as well as a hotline you can call if you have specific questions about the ways in which you can engage in advocacy work.
Thank you so very much for.
I'll turn it to you.
Yeah, thank you so very much, Jessica. And given that, so definitely check out our website, again, protectourcareil.org. You can check out our resources page. That's a really chance to actually get infographics to how you can talk about this, things in which you need to know to have your legislator, and then also the webinar will be there for folks to be able to get access to it there as well. The Take Action page, huge. You can take direct action there. Also figure out which legislator and how you want to talk to them. And then we talked about the Share Your Story. Go to that link really be able to have those stories so we can continue to get those out to the media and let your legislators know that there are people that are deeply impacted by this, and we want to continue to let folks know about that. And then as we talk about direct action that are in taking action right now, you can call the Capitol Switchboard 202-224-3121 to talk to your legislator. And you can put in your zip code, it will tell you, and then you'll get in touch with your legislator. If you just want to look it up, the link is there for your zip to find out who your legislator is. As people have talked about, letters to the editors, op-eds, and just making sure that the media knows about what this is and how it impacts people, and especially in local media markets, making sure that people continuously can hear what people are doing. There's phone banking that's going on. I know that there's phone banking in Springfield, and people are working on in Champaign and other parts of the state, to make sure that people can have continue to reaching out to more folks, let them know about what's going on. And then the 7th anniversary, as Scott has mentioned earlier, there will be actions on March 23rd, next Thursday, across the state. And we want to continue to put pressure from today until March 23rd to continue to let legislators know that hands off our health care, make sure that people that could possibly lose their health insurance continue to know we want to make sure that we continue to have health insurance.
Great. Well, thank you all so much for staying engaged in this really robust conversation. We're excited to continue working with you all and encourage you to check out the Protect Our Care Illinois website and to access the resources that will be made available to you online and through the follow-up email that comes, including following this webinar, including the recording and the slides for the webinar. And if you have additional questions, please let us know and feel free to reach out to the contact information that is provided on Protect Our Care. Thank you all so much.